The next presenter will be Jason, who will be presenting the data from the PIMS study, pharmacokinetics in children. I would love to write the title, but that would again leave you only 6 minutes and 30 seconds. So there you go.
Thank you very much, Jan. My plan is to go through this relatively quickly. So this is the work of Susie Parker and Tavi Dorofeif, and it relates to essentially describing the pharmacokinetics of various antimicrobials in critically ill pediatric patients, a really important understudied area and one which I think was in much need of developing some data. So the PIMS PK research program was essentially studied across the Queensland Children's Hospital and the Sunshine Coast University Hospital, so an Australian-based study looking at commonly used beta-lactams for paediatric patients as well as vancomycin. Sampling was done both from traditional blood sampling methods but also with microsampling techniques, which is essentially, as you can see on this slide here, trying to extract a drop of blood from the capillary bed and then sampling into one of the devices here. This is a capillary microsampling device. So for this study, 134 patients have been recruited, with cefotaxime having the most patients recruited to it, but also very good patient numbers for piperacillin, tazobactam, and cefazolin. Other data collection, of course, is important just to describe the patient characteristics, their renal function. We measured both total and unbound concentrations because, as was presented earlier, the unbound concentration is very important for defining the relevant concentration in the individual versus what the target is. And we took multiple samples throughout a dosing interval so that we could accurately describe the behaviour of the drug over time, and to subsequently then put that into pharmacokinetic models so that we can use simulation to define what optimised dosing regimens look like. So in this study, the average age was 30 months with a weight of 12 kilos. Renal function was quite normal throughout the cohort, and the majority of participants were male. We found that 47% of patients achieved the target antimicrobial exposures, so that's disappointingly low. And we found that the main reason that people didn't achieve their target concentration is because of their renal function. So essentially, the higher the person's renal function, the lower the likelihood they were of achieving a good concentration. And so, of course, this then introduces a really significant opportunity for improving dosing for paediatric patients. One of the things which we understand from many of the drugs that have been developed for use in paediatrics is that a dose is defined in adults. We then do some scaling, so some, I don't know if I'd say clever modelling, some very basic modelling to then work out, well, if that's the dose that's needed in an adult, we need this much smaller dose in a child. And what we can see from this data here is that doesn't work in the context of critically ill paediatric patients. And so we've got some exciting modelling work to do to define what those better doses should be. So I will conclude there after just presenting one of the papers that's come out which provides some of the dosing recommendations as well. Actually, the final point I'll make is about microsampling and what parents and nurses think about it. So microsampling, of course, does require a skin prick, and that's different to what usually is the case where there is a catheter inserted into the patient. What most of the parents and the nurses thought that this was less invasive and less painful if just a blood draw was taken in terms of like a skin prick. And so that's actually very supportive for microsampling. And therefore those parents and nurses recommend that technique should be used in the context of clinical studies into the future. So there are a couple of future directions there in terms of studying in specific patient populations in the paediatric ICU, those patients that are on ECMO, which is the same kind of patient population that Hafiz referred to earlier, and also patients receiving renal replacement therapy. In that study, 85 patients have already been recruited, which is really exciting. And another study is an intervention study, which is really replicating BLING, but in a paediatric cohort. And that's a study being led by Kristen Gibbons and Cy Rahman, the development of that, although there's been no recruitment to that study yet. So I will conclude there and hand back over to Jan.
Thank you, Jason. Very challenging population, I can tell from your data.